What's up, everyone? It's Brian here from Exact IT Solutions. Welcome to another YouTube video where we try to teach you a little bit about cybersecurity and how it relates to your business and how serious things are getting out there. And today I'm taking a little bit of a different tact with our video, and I'm gearing this video specifically towards doctors and anybody in the medical field that deals with patient information and is basically has to follow HIPAA regulations and guidelines. This video, I'm going to kind of review what happened in 2020. A lot of people think that HIPAA really isn't a serious threat, but you're going to find out that that's not the case. Whether you're big or small, you can come under the scrutiny of HIPAA and be fined and sanctioned. And then let's talk about the new law that was just passed and how it affects you and what we need to look for there. So without further ado, let's jump into today's content. And all that I ask is if you see anything today that you like, that you're entertained by, or that you're educated with, please hit the like button. And it really helps us out with Google and will help other medical professionals see this content so they are aware of what's going on out there. So starting off with 2020 with the HIPAA penalties, we're going to jump into that right away. So there were 13 million, and I forgot the dollar sign there, but 13,554, roughly $14 million in penalties. There were 19 total penalties, so just about a little bit shy of 2 a month. And they ranged from 3,500 all the way up to 6.85 million to make up that almost 14 million. So as we go into and look at the most enforced HIPAA penalties and what they were, but failure to conduct an accurate and thorough security risk analysis. And basically what that means is they just, medical professionals and medical entities are not actually getting a risk analysis done. So they have no clue what their risk is, where they have vulnerabilities, and where they are deficient when it comes to HIPAA. And not going through and either doing a self-analysis or having a professional come in and do the analysis for you. This is basically where most entities fail right out of the gate. It's because they're not doing these things to identify it and just burying your head in the sand and pretending like if I don't know about it, then it doesn't exist. That's not how it works with HIPAA. When they come in and do their investigation and they say, where's your cybersecurity plan? Where is your documentation around how you handle X, Y, and Z, and you don't have it, or you're like, what are you talking about? You're going to get fined for that. So that's important to know. And then the second thing is failure to implement adequate security. And that simply means that you maybe had a risk analysis done, or there was an obvious gap in your security and you just failed to address it. That was another reason why HIPAA penalties were levied against entities. This third one would be failure to record and examine activity on information systems. Do you have the proper logging enabled to detect certain things? Just because these logs don't exist or somebody didn't know to turn them on to alert you or to let you know that here's where you need to look to see if somebody's trying to breach your system or trying to do something that they shouldn't. Some devices and some computers and firewalls and what have you, they need to be configured to capture that information. And if they're not, then you end up in this boat where you just don't have the records and you don't have the ability to go in and examine your systems for suspicious activity. And that's another reason why HIPAA penalties are enforced on organizations. And then we also have our fourth one here, which is failure to create logs, access reports, no information systems activity review, which goes above what I said above. you're just not looking at this stuff, or you're not creating what's needed for somebody to examine what's going on within your network. We also have a lot of companies being fined for failure to sign business associate agreements. So anybody that you are doing business with who may have access to public health or private health information, you need to have them sign a business associate agreement. In 2019, there was a $3 million fine levied against Touchstone Imaging because they failed to have a BAA in place with its vendors, including their IT support vendor and third-party data center provider, as required by HIPAA. So these entities had private health information. They had access to it. The IT company did, and the cloud data provider did, because the data was on those systems. And the entity failed to have a BAA agreement in place with those entities. And when an investigation was conducted by the HIPAA authorities, they figured out that these didn't exist, and then that put all the liability on the entity, Touchstone Imaging. So you want to make sure that you have BAAs in place with anyone that might have access to your private health records or your electronic medical records. And then let's talk to the entities like the doctors out there who think, I'm too small, I don't need to worry about HIPAA, I'm not going to have a problem. As we saw in 2020, a one doctor medical practice, Dr. Stephen Porter, probably thought a lot like you guys, and he was fined $100,000 because there was long-standing non-compliance with HIPAA. He failure to conduct accurate and thorough risk analysis, which we've already discussed, and failure to implement HIPAA security rule P&P. So there's a lot going on here with this guy, but it just goes to show you that you can be a one doctor medical practice and still have a problem with HIPAA. So anybody out there that's thinking today that I'm too small, I don't need to worry about HIPAA, I can't afford to even look at or think about HIPAA, you're sorely mistaken. And an ounce of prevention is worth a pound of cure, especially in this case with Dr. Stephen Porter. He may have been able to take care of this stuff for probably less than $20,000, and now he just got hit with a $100,000 penalty, and he's probably going to be sanctioned in other ways, especially if he deals with things like Medicare and Medicaid, which we'll talk about later. This company, Lifespan, a nonprofit, they were fined in 2020 just a little over $1 million because they failed to encrypt all devices used for work purposes. And encryption and the use of encryption on all your devices, including your phones and your computers, and anything that you use at home to use work from home or anything like that, all those things should be encrypted, meaning that the hard drives should be encrypted. Encryption is looked at as a get-out-of-jail-free card, especially with HIPAA. And it's a very simple thing to put in place when you just encrypt the hard drive. So I highly recommend, if you're not doing that now, if that's not a practice that you're familiar with within your organization, or you just don't know, find out. And if you're not doing it, start doing it. It's really simple. Hard drive encryption, for the most part, is fairly simple and straightforward to turn on, as long as you're not dealing with like servers and things like that. It's built right into Windows. You can use something called BitLocker and turn it on. And then every single cell phone and tablet and any device that you may be using that's not a computer, they can also be encrypted. So highly recommend you ensure that you're using encryption across all your devices that you may use for your business, your practice, and especially ones that have private health information, but even the ones that don't, they should be encrypted as well. So if you are a Medicare, Medicaid outfit that does bill through Medicare, Medicaid, you're familiar with MIPS. And MIPS is the Merit-Based Incentive Payment System. and they are going to start forcing medical entities, doctors, and the like to, if you are submitting anything to MIPS for billing purposes, you are going to have to follow a certain standard when it comes to cybersecurity. And in 2021, your payment could be plus or minus 7%, and then on 2022 onward, it could be plus or minus 9%. And these are the things that you need to do in order to receive this money or not receive this money, because they will reduce or increase the amount that you get paid back based on how this works. And what you need to do is you need to do a security risk analysis, and you have to conduct or review a security risk analysis in accordance with the requirements in 45 CFR 164.308A1, and it's to include encryption. You must implement a security update process procedure, and you must correct any identified security deficiencies. You must also deal with this, which is there are penalties within the MIPS program for false attestation. You can be put on a blacklist. You may have to return payment. You may be charged with the False Claims Act, which is a triple penalty from what you were paid. So if you were paid $1 million, your penalty could be $3 million. Again, blacklisted or banned from Medicare, Medicaid, and you could be charged with criminal Medicare fraud if you don't do these things and you bill Medicare or Medicaid. So it's really important that you're aware of this and that you make sure that you are doing the proper cybersecurity and following a framework if you are accepting any kind of Medicare or Medicaid type of payment through your practice. 2021, we also saw the passage of the Safe Harbor Law, which if you do what's required, you will avoid penalties. And this is for HIPAA-covered entities and their business associates. Again, I'm going to be sounding like a broken record here, but you're being told that as long as you follow these things, you will fall under what's known as Safe Harbor. And you must implement recognized security practices, which means you must follow the NIST Cybersecurity Framework, NIST CSF, for at least 12 months. Now, that's easier said than done for 100%, and you must be following it for 12 months. But you have to begin now. And you have to start putting it in place because it takes time to put this in place. It just doesn't happen overnight. You can't just hire a company like ours at Exact IT Solutions and expect us to turn everything around in a month or two. We've worked with companies and practices where it's taken us 3 years to turn them around. And that's moving at a quick pace with a pretty sizable budget. So the smaller your staff, the less money you have to allocate to resources, the longer this is going to take for you to reach a level where you're following a cybersecurity framework like NIST. You will see lower or no HIPAA fines. You'll have mitigation relief from when you have to deal with the mitigation of an event, and you will qualify for an early termination of a HIPAA audit. So when you go through a HIPAA audit, your HIPAA audit won't take as long if you are doing a recognized security practice like following the NIST cybersecurity framework for at least 12 months. And a recognized security practice, again, is the standards and guidelines and best practices and methodologies, procedures, and processes developed by National Institute of Standards and Technology, and it wants you to implement the cybersecurity framework of the NIST, and there are companies out there that can help you do this if this is something that you're not familiar with. But the good news is here, folks, is you have time. The federal rulemaking process, obviously, a law is passed by the House and Senate, and then it is signed into law by the president, which is where we are at today. The enforcement agency issues notice of proposed rulemaking. That has not happened yet. When that does happen, there's a 60-day comment period. And then the final rule is written and published in the Federal Register, and then there's a 60-day moratorium on this. So you're looking at, well over 6 months before this even becomes a thing. But so you have time, but the time to start implementing this is now, because you don't want to wait, and then you're really going to be behind the 8 ball when this becomes the law, and then you need to feel like you should do something, or you have to do something. Now is the time to start this, today or tomorrow. Pick up the phone and call a professional and get them to start helping you. Other important things to know about this is that it's a 357-page HIPAA privacy rule that was issued in December of 2020, and it's already in the comment period. Now, we do have a new president, so it may be delayed as OCR leadership is approved and sets their goals, or it may be fast-tracked because HR 7898 is only, the law is only, in those 357 pages, the law is only 636 words. So it's not a lot for them to get through. So like I said, get a jump start on the 12-month implementation period to qualify. If you start, let's say, next month, you're probably going to already be 4, 5, 6 months into it before this actually becomes law. And by this time next year, you will safely say that we followed a 12-month cybersecurity system or framework in our practice, and that puts you into safe harbor with these laws, with HIPAA and Medicare. So start implementing the NIST cybersecurity framework now, so you qualify when or soon after the new rule takes effect, and start building your evidence locker, which is your documentation to validate your NIST cybersecurity framework implementation. That's the biggest thing here. None of this is any good if you don't have it documented and record it, and you can produce it to an auditor when they ask for it. When you do cybersecurity the proper way, you build an evidence locker, you have this documentation in there. So in the event that an auditor does come in, you can easily just go to this digital locker and pull out the documentation that they're going to need. It's going to make your audit go a lot quicker, and it's going to make your life a lot less stressful when you have all this in place. So get a professional to help you. That's my biggest advice to you. My company does do things like this for firms and any medical entity that deals with private health information and is under Medicare or HIPAA. There's also a ton of other companies out there that do this as well. But don't go at this alone if you don't have the resources to handle it. There are companies out there that will essentially put this together for you and hold your hand and make sure that this gets done. There is, obviously some effort required on your side, but like I said, start today. This stuff is coming. It's not going away. If you're in the medical field, this is your mandate to do cybersecurity the right way. So don't sleep on it and make sure you get it done. If you have any questions, if you run a practice, feel free to drop them in the comments down below. If you were educated in any way in this video, please hit the like button and consider subscribing to our channel. We put cybersecurity content out like this all the time on this channel. And share out our video if you were so inclined to your community. If you know of other medical professionals that could benefit from this content, just share it out to your social media. Hit the share button down below, grab that link, paste it in an email, send it to your colleagues. We'd really appreciate it. And if you have any questions, again, if you're not comfortable putting them in the public forum, in the comments below, you can head over to our website at xitx.com. Click on the contact us button, mention that you saw our HIPAA video on YouTube, and ask us whatever you have, and one of our cybersecurity professionals will reach back out to you and answer any questions you have. So that's it for today, folks. Thank you for watching our video, and I hope you have a great day, and take care.